Let's discuss about the scapulothoracic joint, which also forms the part of shoulder complex. So let's first consider scapula. We know that ideally the scapula lies between T2 to T7 vertebra. And another thing is that the medial border of the scapula is at 5 centimeter distance from the spinous process of the vertebra. That is the distance between the medial border of the scapula and the spinous process of vertebra is 5 centimeter or 2 inches. In this diagram also we can appreciate the resting position of the scapula is such that it is 10 to 20 degrees upwardly rotated from the sagittal plane. Now let's see what is this scaption. So scapula's resting position is such that it is 30 degrees off the frontal plane or the coronal plane, and this is considered as scapular plane. So movement or motion in this scapular plane is known as scaption. And this scaption is the most functional position of shoulder complex or the neutral position of shoulder complex. In this position, the glenoid fossa is facing anteriorly to accommodate the humeral head, and it assists in reducing the impingement symptoms of shoulder complex. So this was about scaption. As we can see over here, the point to be noted is only that the scapula is internally rotated, 30 degrees internally rotated from the frontal or coronal plane. Now, if you are a physiotherapy student, you need to consider certain values as you refer a book. Now, this is from Joint Structure and Function, book by Cynthia Norkin. So, let's see and remember the values according to this book. So, if we consider superior view, we can see that scapula is internally rotated 30 to 45 degrees from the coronal or frontal plane. If we consider side view, we can see scapula is anteriorly tilted 10 to 20 degrees from the vertical plane. And lastly, if we consider this posterior view, we can see that the scapula is upwardly rotated 5 to 10 degrees from the vertical plane. Scapulothoracic motion. Let's see which muscle is causing what movement of the scapula. To understand this, we can imagine the muscle as an elastic band which is having attachment across the bone, so that this elastic band, that is the muscle, will pull the bone in a particular direction so that we can perform the desired movement. So over here, if the serratus anterior wants to do protraction, it has attachment on the medial border of the scapula and it will pull the scapula forward to cause the protraction or abduction of the scapula. So the protractors of the scapula are serratus anterior, pectoralis major and pectoralis minor. As we have seen, first of all, the serratus anterior having attachment or origin at upper 8 to 9 ribs and insertion at the medial border of the scapula, which will help in protraction of the scapula. Another is the pectoralis major muscle, which has attachments as clavicular head at the medial clavicle, and the sternal head is sternum and upper 6 ribs, and insertion at the bicipital groove, which also helps in protraction of the scapula. Another one is the pectoralis minor, which has attachment origin from 3 to 5 ribs, 3rd rib to 5th rib, and insertion at the coracoid process of the scapula, which will again help to pull the scapula forwards and cause protraction of the scapula. So in this diagram also you can see that the serratus anterior will pull the scapula in this direction, causing protraction, and the pectoralis minor can also be seen inserting on coracoid process and protracting the scapula. Retractors of the scapula. Retraction of the scapula is also called as adduction of scapula, as both the scapula come close to each other. So retraction is done by rhomboids, major and minor, trapezius, all three fibers, upper, middle and lower fibers, and latissimus dorsi muscle. Let's start with rhomboids. So rhomboid major coming from T2 to T5 spinous process and inserting to medial border of scapula, and rhomboid minor coming from C7 and T1 spinous process inserting to root of spine of scapula. So now as we know the origin insertion of the rhomboids, we can understand how it retracts the scapula. Now these two are the scapula, and the rhomboids are arranged in such manner which have attachment at the scapular medial border and spine of scapula, so they will help to bring them together, causing retraction or adduction of the scapula. Moving on to trapezius. So upper, middle and lower fibers of the trapezius will help in retraction of the scapula, as they are having their origin at base of occiput and the spinous process till T12 spinous process, and insertion at the spine of scapula and the acromion process. So because of this attachment, it will help in retraction of the scapula. Now coming to latissimus dorsi, as it has its origin from T7 to L5 and also from the inferior angle of the scapula. Because of this attachment, and this is the arrangement of muscle, it will help in retraction of the scapula, pulling the scapula towards each other or close to each other. Next comes the elevators of the scapula. So scapular elevation is done by upper trapezius, levator scapulae and rhomboids, major and minor. Upper trapezius, as we saw, originates from here and inserts to the spine of scapula, will help in elevation, pulling the bone up. Levator scapulae originates from C1 to C4 spinous process, inserting to the medial border of the scapula, that too from superior angle to the root of spine of scapula, which is over here. So because of this insertion and this arrangement of fibers, it will pull the scapula up, causing elevation of the scapula. Next is the rhomboids, major and minor, which also have the attachment, as we have seen earlier, to the medial border of scapula and to the spine of scapula. This will also help in elevation, as the orientation of the muscle fibers is this way. It will assist in elevation. Depressors of the scapula. So depression of scapula is done by lower trapezius, latissimus dorsi, pectoralis minor, pectoralis major lower fibers and serratus anterior lower fibers. So lower trapezius, as we have seen earlier, originates from here ending at T12 and has its attachment on the spine of scapula and acromion process. Hence it also does the depression of scapula. Next is the latissimus dorsi. We know it has attachment at the inferior angle of scapula and hence helps in depression of scapula. Pectoralis minor, which can be appreciated here, coming from ribs 3rd to 5, attaching to coracoid process, depresses the scapula. And also the pectoralis major, originating from here, upper 6 ribs and sternum and the clavicular head, inserting to bicipital groove, also assist in scapular depression. Lastly, there is serratus anterior. The lower fibers, if we consider, originating from those ribs and mainly attaching to the medial border of scapula. So this attachment helps it to pull the scapula downwards, causing depression of the scapula.